Hello! Good day, professors, and to my fellow ISCONARs. I am Renzel de Guzman, and I will be performing medical hand washing and surgical scrubbing. Without further ado, let's proceed. Assemble the equipment. Of course, we need a nail cleaner, sterile brush, antimicrobial surgical hand scrub, warm running water from the faucet, and disposable or sanitized towel. Why do we need to assemble the equipment beforehand? Assembling equipment before the procedure is to ensure the best patient outcome and to prevent further complications, and of course to save time. The first step in preparation is to assess the hands. We need to check our nails. It should be kept short, and we need to remove the jewelry. We also need to check our hands for breaks of skin, such as hangnails or cuts. Of course, why do we need to assess our hands? Artificial nails, extenders, and cheap nail polish can harbor microorganisms. The sublingual region harbors the majority of microorganisms found on the hand. The risk of tearing gloves increases if fingernails extend past the fingertips. Jewelry harbors microorganisms. Break in skin integrity and open lesions increase the risk of patient and surgical team member infection. Next is to put on protective attire prior to beginning scrub. Of course, we need to pull arm sleeves up to shoulder level to ensure that the sleeves will not be contaminated by the water. We need to remove all types of hand, wrist, or arm jewelry because these can harbor microorganisms. During the performance of hand hygiene, we need to regulate the temperature of the water. Warm water is recommended to prevent drying out of hands. Keeping hands above the wrist allows for the microorganisms to slide off the hands into sink. A good amount of soap is required to create lather for 3 to 5 minutes scrub. Washing the hands using these motions on all surfaces of hands ensures coverage of all surfaces. Friction loses resident bacteria that adhere to skin surfaces, reduces and mechanically removes bacteria. This is performed from cleaner to less clean area, eliminates transient microorganisms, and reduces resident hand flora. Hands and forearms are held higher than the elbows and out from the surgical attire to prevent contamination and to allow water to run from the cleanest area down to the arm. Water droplets dispersed by shaking can contaminate surrounding attire or supplies. After finishing the medical hand hygiene, we need to perform the scrubbing. Nail files work more effectively than a nail brush. Clean the subungual area under the fingernails with a nail file. Nail brushes are not recommended as they may damage the skin around the nail. We need to bear in mind that the surgical scrub is effective only if all surfaces are exposed to mechanical cleaning and chemical antisepsis. The majority of flora on the hands is found under and around the fingernails. Brushing other areas of the hands and arms has been shown to abrade the skin surface detrimentally. These motions ensure coverage of all surfaces. Friction loses resident bacteria that adhere to skin surfaces, reduces and mechanically removes bacteria, ensuring both hands are clean and free from contaminations since we cannot sterilize the skin. After we scrubbed our hands and our arms, we need to rinse both hands and arms as follows. Hands remain the cleanest part of upper extremities. Allows the soap to be rinsed off from the cleanest to dirtiest area. Be cautious of not touching the sink as this is a source of contamination. This also keeps the uniform dry and maintains the sterility of the gown. Repeat the procedure as hands are considered unclean if touching an unsterile area. After scrubbing the hands, we need to proceed on our arms. The surgical scrub is effective only if all surfaces are exposed to mechanical cleaning and chemical antisepsis. These motions ensure coverage of all surfaces. Friction loses resident bacteria that adhere to skin surfaces, reduces and mechanically removes bacteria, ensuring both hands are clean and free from contamination. Assuming that we are entering the operating room, we need to use our bags to open the door to prevent the contamination of our arms and hands. This step prevents contamination of the hands and adheres to the principles of sterile technique. Holding on one end maximizes the usage of the sterile towel and keeps the sterility prior to dabbing down the opposite hand. The process of plotting rotational motion prevents disturbance of the skin cell. The drying manner should be from the cleanest to least clean. Do not retrace areas as this would result to contamination. Rubbing skin to dry, it will further disturb skin cells. The fingertip to elbow process completed on one hand and using another portion of the sterile towel to dry the other hand preserves the hands as the cleanest area. Proper disposal prevents cross-contamination.